Kum shibenta banyale ban kenteu ya kecing ajing sumari ki patba ki bapang basitom ha kesempalai jong katayo Myntri ke Sorkar Pdeng ubakmi ya katanat ka kot ka khya UJP nada ulaple patba ya ka ARHI hospital ke badan Hyderabad Haribhoi district.
Kalong gejing urlong ya katong bak jeng angnot juga kenhuan ke batrang mancakri patba akaliang ban sumar po gejing ilam uba ALHEC kemucaman baru MLA kepentor umkra constituency hagaba haga sautri gujeliau arhajar apun rio laple patba ya ka ARHI hospital Hyderabad ke bahap apo ke district Ribhoi ya kene ka ARHI hospital ke bereru ka way nagi benta jangga Far East Wellness Private Limited lawan ban ple patba da UJP nada Myntri ke Sorkar Pdeng bakmi ya ketenat ke kot kakya ha kajing dan rekat Myntri ketenat ke kot kakya ke jela Meghalaya uba awailat miki shela Myntri ke Sorkar jela uba sosteni sotun uba ALHEC ucaman ke ARHI hospital nelor kihe officer kiro paukumat na Meghalaya bat Assam haba kran ha kene gesngi nakaliang UJP nada Myntri ke Sorkar Pdeng ulai kajing ro ke bakrau ya ke kenhuan jong ke ARHI hospital belalam kepat hidup uba ALHEC halor ka jingyo i jengai kajongki ya kajingdangkam kilat ajing sumat bapaka hakni katan stelam ni ulang ru baka Sorkar Pdeng hapo kajing yalam jong Myntri rang bado kari Narendra Modi tanang kio habro kiliang heki jela boper jokari kam tama kebedai bat kilat ajing sumar ki bapaka na kajing pentre kam hok ru ya ka National Health Policy arhajar ka nyo kam tam ya ka East Policy ke bapai kemat kerpang ya ki jela katan stelam ni UJP nada ulah kedauru bag ARHI hospital kadlong sisa kejengker kui patba jong kathan namar gede keja ka ajik sumar kaba labit labyang agajing don kilat sumar ngadu ka oncology unit ka PET CT scan ka critical care service ka neonatal intensive care unit ka advanced diagnostic service but nriu teli ki modular operation theater ha ka bagi patba kem don kam syu bandaj ki jela ki bahe banyo ya ki jing sumar boper
Very warm and heartfelt welcome to all of you on this historic, momentous occasion as we gathered for the inaugurations of ARHI Hospital. Today is not merely the opening of the hospital building, it is the realizations of the visions, a commitment and the dreams of to transform the healthcare delivery in Meghalaya and across Northeast India. It is a day of immense pride and gratitude for everyone associated with ARHI Hospital. I extend my deepest gratitude to our Honorable Chief Guest, Sri JP Nadda ji, for gracing us with his presence and for his unwavering dedication towards strengthening the healthcare infrastructure across our nations. Your presence today inspires us and reinforces our commitment to serving society through quality healthcare. I also sincerely thank to Honorable Guest of Honor, Sri Wainat Miki Shilla, and our special guest, Sri Sasuri Sotun and Sri Ramesh Teriji, for taking time for their busy schedules to be with us on these significant occasions. Your support and encouragement have been invaluable. ARHI Hospital was established with a clear mission to provide a world-class healthcare services at affordable cost, and to ensure that the people of Meghalaya and the Northeast have access to advanced medical care closer to home. For too many long and many families have had to travel great distances for specialized treatment. Today we take a significant step towards changing the reality. On this special day, I would like to express my sincere appreciation to our boards of directors, our medical and administrative teams, our partners, consultants, staff, contractors, and every individual whose hard work and dedication have made this dream a reality. This achievement belongs to all of us.
This is a very significant milestone, a huge initiative which has been taken in health delivery in Meghalaya. At the outset, when I congratulate, I also really admire the vision which you have kept, because in a hilly state like Meghalaya, thinking of a super specialty, that too in the private field, is no less than a dream. It's no less than a dream. And making dream reality is really commendable. So first of all, at the outset, I congratulate for your vision, dedication and the hard work through which this institution has come up. It has got the most modern facility, which I am told, and it's not only the mere creation of the building, but the creation of the hope and the security and the quality which you are providing through this ARHI hospital that I would like to certainly enunciate to you. As you all know that under the dynamic leadership of Prime Minister Modi, the growth story in the health sector has been, and it's not only the health sector. My friend Wailad narrated just now that in only a short span of 1 month, if 5 ministers are coming and they are having meeting in Meghalaya, you can understand how much emphasis is being given and how much mainstreaming has been done as far as the Northeast is concerned, and the thought process when he said that look east, when he said act east. So it's not only in words, but it is in deeds that we have to understand. So under his leadership, really the region has witnessed a rapid development in healthcare also. And I'm happy that this institution which is coming up, it is private in center certainly, but it is with a full-fledged oncology unit. I'm also told that PET CT scan is the only CT scan here in ARHI hospital in Meghalaya. So that is very commendable. And the advanced diagnostic facilities are there, critical cares are there, as MP Singh ji told that there are 6 modular operation theatres are there. So building of the healthcare in the last few years has been very rapid, and if I say so, in the last 12 years that we have to understand. A lot of emphasis has been given to primary healthcare, tertiary healthcare, secondary healthcare, and I would also like to share with you that the thought process, how it changes and how the scenario changes. In 2014, when we took over and Prime Minister Modi as the leader, our dynamic leader, took over the reins of the country, he asked us to relook of the health policy. It was in 2017 that we made a policy which was comprehensive, which was inclusive, and it was preventive, it was promotive, it was curative also. It also took care of the palliative part. It also took care of the geriatric part. So a comprehensive health policy came in 2017. And because of that, for the first time, the primary health care was given importance.